It's always weird to me what becomes controversial for a time in medicine, but if you're pregnant, here are 3 things that you should not say no to when you're in the hospital with your newborn. The first is erythromycin eye ointment. This is an antibiotic ointment that a nurse is going to put on your baby's eyes within the first few hours of delivery. We do this to every baby, millions and millions of babies a year. The dirty secret is that the main goal here is to protect your child's eyeballs against gonorrhea and chlamydia. So you might say, hey, Dr. Williams, I don't have gonorrhea or chlamydia, so can we just skip this one? And I'm gonna tell you that my wife also doesn't have gonorrhea or chlamydia, and we still wanted this one done. Because the truth is, and no offense, the birthing canal is not a sterile environment, and your baby can pick up all kinds of other bacteria on the way out. Now, the American Academy of Pediatrics is actually currently looking at this one to see if it's worthwhile to treat all babies with this antibiotic eye ointment. There are some countries that do this routinely to everybody, and some countries that don't. I will say that in my opinion, the risks of not treating them with an antibiotic is a little bit more dangerous than the risks of the antibiotic itself. Second is a vitamin K shot. Now this one gets really controversial, and I honestly don't know why. We human beings cannot form blood clots, so there's a risk of a spontaneous brain bleed in newborns who don't have any vitamin K. And heaven forbid your baby can't form a blood clot and you get into a fender bender on the way home, or Aunt Millie lets baby tumble out of her lap, or whatever else might happen. And a lot of people will say, hey, Dr. Williams, there is a black box warning about vitamin K, and that makes me nervous. And you know what? They're not wrong. Here's the black box warning. The truth is, this warning is about anaphylactic reactions when giving adults large amounts of vitamin K, not the small doses that we're giving to your baby. And studies about oral vitamin K are mixed at best. Swallowing vitamin K will help your child a little bit, give them some clotting factors, but nowhere near as much as the injected version for a lot of reasons we're not going to get into here. I really struggle when parents refuse this one. The risks versus benefits to me are a no-brainer. Now, the third one is the hepatitis B vaccine. Now, we give this to all newborns since 1991 with the goal to completely eradicate hepatitis B from the population. We've seen a 90% reduction in hepatitis B in children since then. Listen, chronic hepatitis B is a terrible, lifelong disease that kills 1 in 4 kids who get it. I'll be honest with you, the risk of your child getting hepatitis B if mom does not have hepatitis B is super low, like low. And for that reason, some parents reach a pretty logical conclusion that they'll just wait until their child is a little bit older and at greater risk of contracting hepatitis B from blood, saliva, or other body fluids. That last clip took me 8 times to get out correctly without mumbling or stumbling on my words. Count them 8 times. I am a TikTok rock star. Putting off the vaccine does ignore some risks. There's a lot of science here, and I don't want to lose you in the weeds, but delaying this one keeps your child unprotected during the very times when they're at the highest risk of converting a hepatitis B infection into a chronic and deadly disease. For my 2 cents and for my 5 kids, I just wanted them protected as soon as possible. And I get it. We ask a lot of new parents right away in the hospital. Your baby goes through heel pokes for metabolic screenings, they go through hearing testing, they go through congenital heart disease screening, they get tested for bilirubin, the eye ointment, the vitamin K, the hepatitis B vaccine, and that's all just in healthy babies. And I think you'd be a monster to not be just a little bit worried about all of these interventions. We're not dummies, and we want what's best for your baby. These are standardized for a reason. Infants and babies are healthier today than they've ever been. I'd be curious what you're most nervous about for your delivery and hospital stay, so leave me a comment below. And in the meantime, make sure you're following TikTok Kid Doc if what you're looking for is evidence-based, helpful pediatric content to help you raise healthy children.